think there are two main factors which have contributed to increase in duplication of efforts, for example, repeat exams across healthcare systems within healthcare. The first factor is that the incentives system is like that. Yeah. So the incentive system today is largely fee for service. So if you are paid a fee for the service you provide, of course, somewhere in the system there tends to be thinking around, well, we should provide those services in our healthcare system, despite the fact that the patient would have received the same not a long time ago in another healthcare system, to be so that we could actually take on the advantage of that fee for service model. So that's definitely one thinking, which I believe a lot of healthcare systems and healthcare payers, including governments, are realizing that is definitely not a right way to think about the model, and are now implementing programs. Even in Spain, there are discussions currently about how to avoid or sort of discourage that type of thinking. And implementation of DRG models were also a step in that direction. But there is still a long way to go, because administratively managing such programs is, or to say what is real duplication and what is not, and what has a clinical value and what does not, is something not easy. The second factor, which has led to increase in this duplication of efforts, I would say, is lack of trust. And the lack of trust is probably not intentional, but is more consequential. Let me explain why. So, if a patient comes to a healthcare system from another healthcare system or from another healthcare provider, sometimes the thinking is, well, I'm not sure if the patient was given the right test, or maybe they did not have the right technology, or maybe they did not use the right protocols, and that's why I need to repeat the exams here. Now, that thinking has some merit in it, because especially if you are going for complicated diagnosis, you better be sure that the right procedures have been followed and the right technology has been used. But in less complicated diseases, which is typically 70 to 80% of the patient populations that show up in a hospital, I think we need to be conscious that sometimes good enough is good enough, and we need to give it a proper weightage, even if the exams or the tests were not done within the same health systems. So I do believe that these two factors have contributed to increase of the duplication. Nevertheless, the whole healthcare community is aware of these, and I do see a lot of positive discussions from all the fractions in that direction to make it better.